Well, Saigo and good afternoon, everyone. I hope all of you are continuing to do well at this time. Yawa to Reen and CKON again for making time for me to provide the community with an update. Also, as Reen mentioned, we are taking questions this afternoon. We also are streaming live on our MCA Facebook page and recording the show to share later on so that people who aren't able to join in right now can hear the update, as well as Reen mentioned, calls will be taken in at CKON 575-2101, 358-3427 for questions after my update. So at this point, it's now been 8 weeks since we declared a state of emergency for Akwesasne. I do want to acknowledge that dealing with this pandemic and practicing all of the necessary precautions, especially the social distancing, has been extremely difficult for all of us. And on behalf of the Mohawk Council of Akwesasne, Yamagoa to everyone who has been practicing all of the necessary precautions in our fight against the spread of COVID-19. For today's discussion, I'll provide updates on the emergency food package distribution, the Akwesasne Garden Initiative, our long-term care facilities, and the eventual resumption of MCA operations. As you know, the Mohawk Council of Akwesasne declared a state of emergency on March 16, 2020. At that same time, we also began providing emergency food packages to community members in need. This started out strictly as a delivery-only service, but over time transitioned to allow for pickups at each district school, with the first hours being dedicated for pickups by elders. Delivery continues to be available for AMBI families, community support clients, elders, and those without a vehicle. Notices were routinely sent out to inform the community about the emergency food packages, that they were encouraged to call the Emergency Operations Center to sign up or make arrangements for delivery. It has been noted that community resources were limited and priority would be given to those in need. I just want to note that the overall spent on the emergency food package distribution has been approximately $214,000. This Friday, May 15th, is the last date for emergency food pickups and deliveries. This initiative is being discontinued at this time. However, the MCA is looking at alternative ways to continue to provide our community members who are truly in need with food assistance. The way we do this is yet to be determined, but once we make that decision, we will announce it to the community along with eligibility criteria and the contact information. One idea that we came up with to meet the food needs of the community members is to provide assistance with individual gardening needs. We surveyed community members from April 24th through to May 1st to inform them about the initiative, to determine if there was any interest, to determine if they would be eligible to receive a raised bed garden, to find out if there were other type of gardening assistance that people needed. So this is what the survey was intended to do. Through the survey, we were able to determine if community members were interested in a raised garden bed, if they needed soil, seeds, plants, or one or all of the above. We've also been able to identify community persons who may just want tilling services for their own existing gardens or lawns or fields that they may have. We've also developed informational material to be successful gardeners for these to be distributed to the community. So the survey closed on May 1st, and there was about over 500 surveys completed. We've determined that the overall cost to assist over 450 community members with the various garden needs will be approximately $116,000. Council approved the immediate overall funding for this initiative just yesterday. And I need to add that we've also received some generous donations from the United Way, CKON, and the Ontario Power Generation for this initiative to help make it possible. So I want to say Yamagoa to those organizations for helping out. We've also submitted some various funding applications that we've yet to receive responses on, but those are also some potential sources to help with this program. The goal, of course, is to produce nutritious vegetables, but in addition to that, gardening will provide a positive, meaningful activity that community members who live in the same household can work together on. while enjoying, hopefully what's coming, some nice weather ahead. More people will become informed about the best practices of gardening, and our community can pass on this knowledge to our future generations if we involve our children in this process, from the starter plants or the seeds to the harvesting of the vegetables. This week, the staff of Dejo Denawago will be reaching out to community members who filled out the survey and were deemed eligible. It's important that these calls be answered and that messages be returned as soon as possible, because delivery of the boxes are beginning this week. Plants and soil will be delivered next week. So deliveries will continue to take place until about the end of May, so a couple weeks. We ask that community members please exercise patience as we're working hard to assist them with their gardening needs and getting the gardens delivered. With the beautiful weather that we've had a little bit of and that we know is coming forward, we're all looking to enjoy some fresh air, some time outside, and even more so with the current requirements that we stay home and we need to social distance. This is no different for our residents of our long-term care facilities, Akwesasne on Cornwall Island and Akwesasne and Snai. On April 28th, the MCA Department of Health notified the community that restrictions of visitors at these two facilities had been expanded to no visitors on the property and the property surrounding these facilities, which means window visits are no longer allowed. This decision further restricts visitors at the facilities was not taken lightly. We recognize that these restrictions is difficult for the residents as well as their families, but the decision has been made in order to best protect our residents and keep them safe from the COVID-19 virus. Residents of the long-term care facilities are considered high-risk population due to their age, their close proximity within the facility, and their pre-existing medical conditions. We want our residents to enjoy the fresh air and time outside, but it's impossible for us to confidently take our residents outside knowing that family members could show up unannounced at any time. And if that were to occur, all residents would need to be brought back inside the facility for their safety, and that wouldn't be fair to them. If the window visits that were taking place had been continued, it would require that the windows continuously be disinfected inside and out for the community and our residents' safety. The safest option for residents is to not allow residents and employees, is only to allow the residents and only employees on the property at this time. The community needs to understand that breakouts are occurring in long-term care facilities across Canada at this time, including Quebec and Ontario, and we cannot take the risk of an outbreak of COVID-19 occurring in one of our long-term care homes in our community. We all know this pandemic response continues to change, and the MCA will revisit this decision as soon as it's reasonably possible. Family members of residents are strongly encouraged to continue to virtually connect with their loved ones for the time being. Akwesasne and Akwesasne both have equipment with iPads to allow for FaceTime and Zoom video conferencing. You just need to call the facilities and make those arrangements. And we also are currently in a process of setting up much larger screens at the facilities so that families are more visible than on the iPads. And that was a question or a request that had come in one of our earlier updates. So I understand that this decision is very upsetting and has upset some community members whose family is in there, but I trust that our reasoning for this decision is appreciated. In addition, notice was sent out last week to advise community residents that all residents, employees, of long-term care facilities are going to be tested for COVID-19. This test applies to all long-term care facilities in Ontario and is a precautionary step by the Ontario Ministry of Long-Term Care to reduce the risk of an outbreak. We are taking all of these precautionary steps to ensure safety of our residents during this unprecedented time. And while we're on the subject of testing, I do want to report that there has been 31 tests done here in Akwesasne at our mobile unit, and we have come back with 0 positive cases as of today. As I announced 2 weeks ago, the MCA decided to reopen, to reopen will be doing so on a gradual basis to ensure that precautions are in place for the safety of our employees and all community members. I can now update, as of today, we're looking to reopen the organization for service as of on June 1st, 2020. At this time, the MCA as a whole is looking at several service delivery models that will enable us to protect our employees and community members while still providing services. Many of our applications for services will be made available online for those of you who are comfortable with the use of technology. And a complete list of available services will be provided to the community prior to the reopening. For those who are still wanting to receive services in person, we will be working up, setting up to make that service available, but understanding a lot of things will be going online for your safety and for our safety as well. So this is everything I want to update the community on this afternoon, Reen. I am open to take questions on what I have reported or what the community would like to upbring.
Thank you very much. Again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict, providing an update to the community in relation to COVID-19 pandemic response by the Mohawk Council of Akwesasne for the jurisdiction under the MCA 3 districts. So as we continue through the program, again, the phone lines are open, 518-358-3427, 613-575-2101. And you can phone in your question. We'll ask it for you. I've got our first question for the Grand Chief. Listener wants to know, is Mohawk Council of Akwesasne paying their essential workers more for continuing to work? And I believe they mean those through the working through the pandemic here. And if not, will they be getting it now that Trudeau announced it on Friday, May 8th, that all essential workers will be paid more?
Yeah, thank you for the question. So the council, the administration of the MCA brought forward a recommendation approximately 2 weeks ago to provide an increase in essential workers' salaries. That has been implemented as of today. Going forward, as we look at reopening, there will be some changes again to the salary compensation scale for healthcare and essential workers going forward. But as of right now, yes, there has been an increase to workers on the ground.
And our next question, how are we going to safely open the organization and services, programs, operations, buildings when we don't know how many are positive or asymptomatic or symptomatic rather for COVID-19 pandemic?
So as we work towards the reopening of the MCA to provide services to the community member, we will be doing building modifications. There will be policies put in place, screening mechanisms. All employees will be screened. They will be asked a series of questions, also taking their temperatures as well. Any employees that may be sick will have to go home. The days of coming to work with a cold and other symptoms and just not being around employees are no longer going to be afforded. People will have to take time off being sick. The facilities in which we are in, some employees work in areas together. Modifications will have to be done to those areas. Plexiglasses will be put up in public, in common areas, public areas as well. We are moving towards, the provinces and the country Canada is moving towards wide open testing going forward. That is something that we will be looking at as well. So I can assure you that, we are putting in, as many safeguards as possible to ensure that our employees are safe, our community members who are accessing services are safe, but also, we will, for the foreseeable future, have to be accessing services virtually over the phone because this is the only way that we can protect the community and the staff that are providing those services. So all of the considerations are in motion now and are being developed to safeguard as much as possible, but people need to continue to do their part as well.
And another question, what are your thoughts? Should it be mandatory for all essential workers to be tested?
Well, again, as I just said, testing the government is looking at broadening testing. The screening will be required. It is currently required. It's actually happening now in our Akwesasne. Every person coming in is asked to answer a series of questions. this will continue going forward. Essential workers, we will have to continue to examine, the requirements of being tested. I don't have a direct answer for that, but this is a fast, rapidly evolving, pandemic, and the virus is how we treat it and safeguard ourselves is constantly changing. So we are, looking at what the best practices are, taking, advice from the federal government and the provincial government. So this is, this has not been determined yet, but it's also not been ruled out.
All right, our next question. I know you referenced 31 tests being given at the MCA mobile testing site for COVID-19, and you mentioned that there were 0 positive cases. Listener would like to know, is there a record of how many people have been tested per district? Has that been broken down per district, the 31 tests?
As of right now, I don't believe so. I don't have that information of what the district breakdown was. It's something we can look at, but also these 31 cases, the persons would have exhibited some sort of symptoms, meaning a fever, having been exposed or potentially exposed to somebody with positive, or had been in an area that has a high concentration of positive cases. So they're not just random tests, but we can look at breaking that down for the community.
Another question with regards to testing. Community member would like to know, what is our goal number-wise for testing in each district before it's safe to open Akwesasne for business on the northern portion?
There isn't a number set as far as, we need to test a percentage of the community to ensure that, the risk is low. People need to continue to do their part, need to, so continue to social distance, not be congregating in large groups, ensuring that we are hand washing frequently, and just being very vigilant that we're doing our part to limit, exposure and risk to others that we may be around.
And again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict. He's providing an update to the community in relation to COVID-19 pandemic response by MCA for the jurisdiction of Mohawk Council, which includes the 3 districts, Sny, Severages, and Cornwall Island. As we continue through our questions from listeners, are there any updates on and this could probably be broken down 2 ways, so I'll ask you, first of all, any updates on the travel ban specific for MCA employees?
So there still is in effect, we want community members to not be traveling outside of the 50-mile radius of the community. If you do, we're asking that you quarantine for 14 days in your home. Specifically, employees, it's not going forward, it's not something that I can tell you that the employees of the MCA will be doing anytime soon, is traveling for work. We do know that Montreal is just down the road, is a city that has the highest rate of infection in Canada. So, we're not going to be allowing employees to be traveling. If employees are essential workers that are working for us, they should not be traveling outside of the area because this is part of their employment to be staying within the 50-mile range.
And do we have an idea on how long that 80-kilometer, 50-mile range with regards to traveling will continue to be implemented?
So currently, right now, we're revisiting this all the time, and we will be having a conversation with the tribe this afternoon, and we will, we want to be able to do this together. Which way we will be moving on the restrictions within the community.
All right, so having to, again, work together with the Siverages Mohawk tribe, you have both implemented, both MCA and Siverages Mohawk tribe, both organizations have implemented the curfew from 10 p.m. until 6 a.m. How long is that going to be in force?
One of the things that we need to realize and recognize is that as Indigenous people, we are more prone to infectious diseases. So we are a higher risk population. So as we see, the provinces and the state of New York start gradually opening, we need to continue to be very cautious on how we react in our community here. Because we have a vulnerable population, we have an aged population as well. So going forward, we'll continue to look at how the provinces respond, how the state responds, as well as how the new cases of COVID-19, if they begin to rise, what that means for us here as well, what that means for the provinces. So as we analyze that and as the things start to open up, we will continue to look at how we respond here. That includes the curfew and the not having all the businesses opened. So really it is a day, it is almost a day-to-day how we're taking this. We don't have a definite right now, but we're going to continue to loop in with the tribe and have a conversation with their leadership. We continue to have regular updates with the provinces. We hear what the federal government is saying. We do have regular calls with the Indigenous services as well. So there's a lot of indicators that are around us that we can use. But I want to remind the community that while we may not have positive cases here, we cannot let our guard down. We are not immune, and in fact, we are a very high risk group of people that we need to be extra vigilant if we're trying to not get any new cases here and slow the spread for our elders, our children, and ourselves.
Our next question: what is the plan for opening daycares as children do not know how to social distance?
As of right now, you may know that Quebec has opened their schools back up. So we will see again how children react to that, how the systems are supporting the reopening. We will use those as indicators, but as of right now, that is not something that is on the higher of a phase of reopening is of the daycares, because we do not want any outbreaks in the daycares. We also are seeing in various areas of the country and across the globe that children are developing other diseases that may be related to the coronavirus. Or coronaviruses, I should say. So we need to be very cautious on how we move forward. No definite date has been set for daycare reopenings, but they are not on the first kind of phase of reopening.
And taking a look at the suggestion for Akwesasne and Chief, one caller says for the residents at Akwesasne and Chief, they're asking why not allow scheduled visits through time slots to allow for window viewing or, something with adequate distancing, or perhaps they could set up video chats for elders so they could stay in touch that way. I know that we have been announcing that is available. I know you referenced that in your presentation today as well. So I guess we will go with the first part of that question. For the residents at Akwesasne and Chief, can we look at that part of it, scheduled visits through time slots and the window visits?
Currently, as of right now, we're not able to. We have to understand that our healthcare workers are under extreme amount of pressure. We continue to see that nursing homes in Quebec and Ontario have continued to have outbreaks in their facilities, and some with devastating effects. So this creates a lot of stress and anxiety on our healthcare workers and all of the administration supporting them. Having to schedule that is it is easy, but it is also something that has to be, somebody has to look after the client here as well on within the facility. We need to make sure that anybody on the other side of the window is not carrying or not carrying, but if they are carrying, then they're not transmitting it to the next person that comes to the window, which means somebody has to clean the window every time a visit occurs. We're just not in a position right now to be able to do this. And I must say, limiting on the property, we have a curfew in place. We're asking people to social distance. We're asking people not to gather, but people still are not abiding by the curfew. People are still not social distancing. People are still they're still gathering. I drive by homes and sometimes see 6, 7 cars there, and I know they don't have 6, 7 cars of their own. So people are not listening, which then some people are not listening. There's enough people that are listening, but some people aren't listening. So maybe your mom is in there and you understand the reality of the threat of you having an interaction with your mom. So but maybe your nephew don't, maybe your son or daughter don't, right? And that's why the decision has been made that we can't have anybody on the property. Somebody showing up unannounced is too high of a risk for our elders, and at this time, we're not allowing the window visits. We're not allowing any families on the property, but recognizing things are changing very quickly. We will again revisit this decision as soon as possible, that it's safely to be able to do that.
All right, we're listening to Mohawk Council of Akwesasne Grand Chief Abram Benedict. He's addressing questions from the community. I want to let everybody know we will stop the program at 1 o'clock. I will try and get every question that has been phoned in so far on the air so that the Grand Chief can comment on those and try and provide the answers that you're looking for. You're listening to CKON Wednesday to Ottawa. It's a live edition, and the original air day of the program is Tuesday, May 12th, and that's 2020. So continuing on with questions, Grand Chief, when MCA opens on June 1st, will they have masks available at all facilities, whether it's required or not?
So the June 1st is tentative. Remember that we're going to watch how the organizations around us, how the provinces and the numbers rise. So it is tentative. The masks, well, I mean, there's been a lot of debate around masks. The Governor Cuomo in New York has said that everybody who cannot social distance must wear a mask when out in public. We've seen that, there's been reports that, the masks don't help unless they are N95s, which are not very difficult, but are difficult to get, which we've we've reserved them for the healthcare workers. If an employee wants to come to work wearing a mask, that's up to them. We haven't made a decision yet if it's going to be required of employees, and if it is going to be required of employees, masks will be made available.
Now, our next question, you referenced Mohawk Council of Akwesasne employees must stay within the 50-mile radius or 80 kilometers. What about employees who drive people to doctor's appointments in Montreal, in Ottawa? What happens to them? Do they have to quarantine for 14 days as well?
Yeah, so because the fact of people leaving the territory for medical, somebody in the vehicle, whether it be themselves driving themselves, or your aunt, your uncle, or it may be a medical driver for us, you're in the same vehicle. If they went into a hospital, the hospitals are a bit of a higher risk zone for contacting COVID. So any person that has driven somebody outside of the 80 kilometers or 50 miles, yes, needs to be quarantining at home. We do have some non-insured workers that work for us that drive residents or members to the hospital. They're on a regular work schedule, but when they're not, they need to be in their homes because they've been exposed.
And our next question, because we are a high-risk community, should and will testing be readily available for community members and MCA essential employees. I know you touched on that a little bit, but we might have someone who's just tuning in.
Yeah, so again, the provinces are looking at expanding more testing to everybody. As it is right now, you have to exhibit some symptoms, have a fever, been exposed to somebody, or may have been exposed to somebody that's tested positive before you can call and make an appointment to be tested. We know that that likely will be expanded. Whether or not we make it mandatory for employees had not been determined yet.
And next question, where can we get masks, hand sanitizer, and gloves? This community member says the stores don't have any. Is MCA going to provide this for us?
Right now, no, we are not providing them for the general public, but what we are doing is, what we have done is ordered quantities of that for our workforce, so that there are, the hand sanitizers at every workstation, so that, their proper disinfecting is happening. Masks, again, we haven't made a decision if that's going to be required or not. There's a debate around that medically, whether or not, you should be wearing those or not. So we have not made a decision exactly on that. If there are community businesses that are having issues, they should call our EOC to inquire where these products may be available for them to purchase for their customers or themselves. But for going forward, when we do open those hand sanitizer, hand washing stations, things like that will be available within the facility for the staff and for community clients that we're serving.
Our next question, listener would like to know, where can we get, let me see here, okay, how many times can you do the CERB? How many times can you sign up for CERB, C-E-R-B?
So there are the guidelines on the CRA website for who is eligible. There is periods of time that are for when you are not working to be able to apply. The government has set a time period for how long they'll continue to provide these supports, but I would suspect that if the pandemic continues on, if businesses are not able to open, that the government will extend that benefit period. So persons who are applying for the CERB who have not lost their income, or are community support clients, or are receiving Canada pension, and have not lost their income, should not be applying for this. If you have lost your income and you meet the criteria, then yes, you should be applying for the CERB, and continue to look online for the updates as they extend the program. So how many times you've been able to apply since it's been announced? Going forward, you'll be able to continue to apply for it, provided that you still meet the criteria of not being able to work and that you don't have another source of income.
All right, our next question. Why did the food distribution come to an end?
So we've made the decision to stop the food distribution as a whole, as a wide open, for a couple of reasons. One, when we started this, we've seen a lot of panic buying happening at the stores. People were extremely scared. We're going to the grocery stores, buying up lots of, of food, lots of groceries, and which were leaving the shelves empty. And we knew that some of our social recipient clients, some of our elders who are on a fixed income, were only getting, we're getting monies at one time of the month. And what we were seeing is that they were going to the grocery stores and not being able to purchase, certain products. So we felt that it was important that we be able to, provide for the food deliveries to those in need as well. We wanted to make sure that people, we didn't know where the numbers were going. as far as positive cases in the areas around us. Now we've seen, where they're at now. Cornwall is, has not an extreme number of cases, but has a few. A number of them have been resolved. So the risk is still there. It's not as high if we were in the center of, Montreal and having to go grocery shop there. So that was another consideration that we've been able to, as a community and as well as a region, to keep the case numbers low. So that has, lowered the risk a bit for our community members. And people are adapting to being in the new, the new norm that we're in now for now, and that is in a pandemic, of having to be vigilant about our exposure and our risks, as well as having to do, a grocery shopping for periods of time that we may not have been before. And so the decision has been made that we will stop the program that is open at broad. If there are clients that are still in need of assistance for the purpose of groceries, we are going to be rolling out a different program for them.
All right, our next question. We're going to go back to some comments made earlier. Just to clarify, MCA employees like non-insured medical transports, do they have to quarantine for 14 days? Those MCA employees?
Employees or persons that have traveled outside of the community need to be following the rules and quarantining for 14 days. That's my understanding. That is the directive that's been given to them as employees. I can verify that, but that is my understanding of what's required.
And taking a look at summer jobs for our students, high school students, college and university students, where are we with that? Do you think that they'll be able to get jobs within the organization? Is that something that's even being talked about yet?
So as part of the partnership with Access, which is formerly the Akwesasne Area Management Board, they used to provide, or they would provide some summer student jobs every year to different businesses or organizations in the community and the MCA. So this year they are providing them to the MCA. We will have a few summer jobs there. They're currently going to be supporting some of the garden work that we have going on. But as far as abroad, I think that we'll be limited on the number of students that we can bring in. One, for the fact that we don't have all of our workforce being returned back to the facilities. As well, we have to take into consideration the safety aspect. So I'm going to say that, there will likely be less summer jobs in the MCA this year, as well as within the community. Now that just leaves, more students without an income for the summer. And the federal government has rolled out some programming for students that are unable to find employment, since the employment numbers in Canada and the United States are through the roof because of the COVID-19 virus. And as soon as we receive more information on that program that the federal government has rolled out, we will be making that available to the community for students who meet that criteria guidelines.
All right, so I'm going to close our phone lines now. We'll wrap up with a couple more questions, and we'll let MCA Grand Chief Abram Benedict go at 1 o'clock. So another question with regards to supplies, PPE, personal protective equipment. How is our Mohawk ambulance and Akwesasne Mohawk police service, as well as our different clinics here on the territory? How's it going with that supply level of PPE for those important frontline workers?
Right now, we still continue to receive our orders of supplies. We do have, we had a bit of a stockpile, which we were accessing. So we're not in bad shape. We don't want to, take anything for granted. So we're going to continue to collect as much as we can going forward. You may have heard, us talk a bit about a second wave is something that we don't want to have, but we can do the best we can to ensure that we don't have a second wave in our community. But if we do, then that increases the need for PPE outside of our regular need. So that, we're continuing to ensure that we not stockpile, but have enough. But thus far, we have been able to continue to receive PPE for our nurses, for our healthcare providers, for our police services, and for our ambulance workers, and people, some other positions that may need it. So.
And another question with regards to Dr. Dan, the dentist. Will that office be able to reopen? Have there been any talks with Dr. Dan? And I know that Dr. DeBook's office has reopened a bit with regards to some of the services they can provide, limited services. Have you talked to Dr. Dan?
Yeah, so I understand that our health department has been in contact with Dr. Dan. Obviously, him being a licensed professional has to follow certain guidelines. So once he does reopen, he will be required to follow those guidelines and while providing services to his clients. Currently, right now, the facility of Akwesasne has not been completely retroed for the protection of the staff and the community. So, and I mean by as far as markers on the floors, as far as signs indicating keeping distances, as far as plexiglass to shield, community from workers in different areas. Those improvements have not been made yet. The planning and procurement is underway, so it does affect Dr. Dan in his facility. We are very conscious that we want to be able to have those services reopened safely to the community. But we've had conversations with him. He is on our radar, and as soon as we can do it safely and that his regulatory bodies allow, that service will be provided.
All right, so those are the questions that I had for you today, Grand Chief, and we would like to wrap things up now. I'd like to say Nyawagoa to everyone that has phoned in questions today. We appreciate it. Getting that information right from the Grand Chief always helps to clear up any miscommunication or any stories or things you might have heard. So everything that we talked about here today confirmed by Mohawk Council of Akwesasne Grand Chief Abram Benedict. I do need to send a shout out to a young man out there in Radio Land, my buddy Vance Gray, who is listening today. He wanted to shout out. So there you go, Vance. I hope you're having a great day today. And thanks for listening to Mohawk Council of Akwesasne Grand Chief Abram Benedict today. We sure do appreciate that. So Grand Chief, I will leave you with your closing remarks, please.
All right. Well, shout out to Vance as well and everybody else who is listening to us this afternoon. These past 8 weeks have been very trying for everyone. I can't repeat enough that we all must continue to do our part and continue to social distance. I know this has not been easy, and we continue to take this one day at a time and support each other along the way. We have to be patient a little bit longer and continue to have faith that things will get better. Reen, thank you for the time this afternoon. Yalangoa to all our healthcare providers, our healthcare workers, our essential workers who are working hard to keep our community safe. And Yalangoa to you, our community, for supporting one another at this challenging time. And Akwesasne, we will get through this together. So, Yalan, Reen.
Yalangoa, Grand Chief, please take care and thank you for your time today. Nyawa, ona.